the surgery is done by a cut across the neck, which oftentimes alarms people because oftentimes this is what we think of as a way to kill somebody. But the reality is, although there are big blood vessels in the way, they're moved aside, and there is very little danger of significant bleeding during this kind of surgery. And in fact, because there isn't a lot of muscle in the front of the neck, the surgery is less painful than other surgeries on the spine. After moving the throat out of the way, through a microscope, we remove the disc, drill away the bone spurs which are squeezing on the spinal cord, relieving pressure on the spinal cord. Once we do this, there's a large hole that needs to be reconstructed, and it's reconstructed with a small piece of bone that comes from a cadaver, although this piece of bone is not living tissue and has a very low risk of giving you an infection. After removing the disc, I place a piece of bone in place of where the disc once was in order to strengthen the neck, and this is done at each level where there is pressure on the spinal cord. In order to ensure that this piece of bone that I put in does not slip back out, I usually placed a metal plate to hold that still. The purpose of the plate is to hold it still long enough so that one's own bone grows into the bone that I insert. After that, it's not necessary for the plate to be there anymore, but we don't do a second surgery to remove it. Most patients awaken with a sore throat, with some difficulty swallowing, some hoarseness of the voice, and stiffness in the back of the neck, and each one of these improves over a course of several weeks.